But first, Boris Johnson is expected to confirm tomorrow that lockdown restrictions will be lifted on July the 19th, despite the rise we're seeing in infections. To talk about that and much more, we're joined by one of the government's top strikers, the Vaccine Minister Nadhim Zahawi. Good morning, Minister. Now, tomorrow the Prime Minister says he's going to confirm whether July the 19th will herald the lifting of restrictions. Are you seeing anything in the data that might prevent him giving us the green light?
So you're quite right. Tomorrow the Prime Minister will, as he outlined a week ago, that he will share with the country the latest data. The really good news is that 86% now, almost 87% of all adults have got the protection of one dose, and 65% are now protected with two doses. The target is that we get to 66% double jabbed by the 19th of July. We will meet that target. So I'm confident that we can proceed to step forward, but cautiously. And we will be setting out tomorrow guidelines on everything from mask wearing, the transition from sort of mandating or government by diktat to taking personal responsibility, whether for our own actions or corporate responsibility at Sky and obviously at Transport for London and elsewhere, about proceeding cautiously. I think you said it at the outset of your programme. This pandemic is not over. We're seeing a rise in infection rates in this country, but also in Europe and elsewhere. The difference is, for us, is that the vaccination program has been so successful that we are, as I say, almost 87% of all adults have been protected with one dose, and we will hit that 66% with double dose. So it was right to give ourselves a bit more time. If you remember, we paused for 4 weeks to be able to protect more people.
Minister, does all of that program include the prospect of reducing the interval between first and second doses, as is being reported this morning?
No, I'm slightly puzzled where that story's come from, because obviously I engage almost on a daily basis with my colleagues at the JCVI and Professor Wei Shen and Professor Antti Handen, who look at this very closely. The real-world data, the clinical data, suggests that actually the 8-week interval offers that additional fortification in terms of protection with the two doses, much better than having the interval shortened any further. And of course, the Prime Minister announced that now we've brought down that interval from 12 to 8 weeks for all adults. So anybody who gets their first dose now, and I absolutely encourage everyone, as hopefully they'll be doing, we've got a site next to Wembley Stadium who will be also offering those jabs, and at Millwall Stadium and lots of other football stadiums, Etihad and elsewhere. If they get their jab now, they'll get their second jab within that 8-week interval. That is the clinical advice, and that's the advice we will follow.
So we can be clear, to take today's jargon, that when it comes to vaccine, you have to hold and you have to give at the right time. You've decided, actually, that there is going to be no change on that.
Well, obviously, the Joint Committee on Vaccination and Immunisation, these are the experts, look at this all the time, and their advice is very clear that the real-world data suggests that the 8-week interval is actually the best in terms of giving everyone who's had their first dose, their second dose, and that protection, the added boost in terms of both antibodies and T cells is within that 8-week interval, rather than shortening it any further.
Okay. Let's clear up one thing that has created a small mystery this week. You and other ministers have been saying for some weeks that the link between vaccination and serious illness, hospitalisation and death has been weakened but not broken. But on Wednesday, the Prime Minister said it has been broken. Now, if anybody should know what the truth of that is, it's you. What is true? Has the link been weakened, or has it actually been broken?
Well, I think the Prime Minister at the press conference last week talked about, as did Patrick Vallance,
Well,
that
so
the
we're
link
clear.
has
He
been...
said at Prime Minister's
Yeah.
questions that scientists are absolutely clear that we have severed the link. Now, is he right, or are you still saying what you did before, which is that it's weakened?
I think there's whether it's the language of sort of completely severing the link or otherwise, the reality is that we, through the vaccination program, have severely weakened the link between infection rates and hospitalization and serious infection. If you look at the data, so I looked at this before coming on your show, as of Friday, in terms of people in hospital, 62% of those in hospital, of the 2,300 people in hospital in England, 62% are under the age of 55. In the previous waves, that would have been the other way around. So it would have been the majority would have been over the age of 55. Only 15% are over 75. So it is weakened, but people are still obviously getting infected. The majority of people who are severely infected are those who are unvaccinated, which is why I go back to the same message, saying, if you haven't been vaccinated, get vaccinated.
I get all of that, but we're not dancing on the head of a pin here. The distinction is important. Whether I have broken my arm or I have severed my arm, rather different situations. So what we're being clear about this morning is that we're still in the realm of the link being weakened, but not severed. So the Prime Minister, let's call it, misspoke.
It has been severely weakened through the vaccination program, and the Prime Minister, I think, I listened to the press conference, he spoke very clearly, as did Patrick Vallance, that the link has been weakened by the vaccination program, the success of the vaccination program. I think it's important that we remain cautious and careful, and the guidelines that we'll set out tomorrow will demonstrate that, including guidelines that people are expected to wear masks in indoor enclosed spaces, and of course to remain vigilant with hands and face, and to just remember that if we all act responsibly, as we did with the vaccination program, the nation came together to vaccinate 80,000 vaccinated volunteers came forward, out of retirement, and to vaccinate. We can come together and deal with this pandemic in a way that is responsible by thinking about our own actions and how they impact other people, including, of course, people who are maybe immunocompromised.
All right. Minister, I'm sorry if I appear to be hurrying you up a little bit, but there's a lot to talk about and a lot to get clear. The Office for National Statistics tells us that the 7-day average for vaccinations dropped from over 200,000 in late June to just around 100,000 at the beginning of July. Would you accept that we're running into a period of slower vaccination rates?
Yes, I do. And these are the hard yards, Trevor. So back to the numbers I quoted you earlier, we're almost at 87% of all adults have now got their first dose. The majority, we were running at about 96% return for their second dose. I want to get that to 100% if I can. The Office for National Statistics also say that 96% of all adults will very likely take the vaccine. They think very positively about vaccines. So the hard yards are to get that 86, 87% where we are today to 90+% vaccinated, because actually what we need to make sure is, as the virus gets desperate and attempts to infect people, to mutate and be able to survive, we should continue to fortify the nation with the vaccination program, because that is the way we transition it from pandemic to endemic status and deal with it in the future with the booster campaign in September, as per the interim advice from JCVI, and of course then maybe an annual vaccination program for COVID as well as for flu, which we're planning to begin from September, and look at how we can co-administer flu and COVID.
The reason I asked you about that, Minister, is that there's a crunch coming here, isn't there? Your boss, the Health Secretary, says that we might be looking at 100,000 infections a day, that if we keep the pinging regime as it is, we might be talking about 1 million and more people being pinged and self-isolating every week. And that's just if we assume that it's just 2 infections per person, and nobody's sure about that. The point is that the government has rested pretty much everything on your continuing success on keeping the vaccine rollout at pace. The problem is, you guys are taking a bit of a punt here, aren't you? You are gambling that the vaccine rollout can keep ahead of all of those other problems, including the possibility of variants. It is a gamble.
So, Trevor, there are no easy decisions to make on this, and let me try and bring it to life for your viewers. On Friday, I do my constituency surgery. I went to visit a business in Ulster called Orange Mabel, which is a lovely tea shop in Ulster, who's really weathered the storm and survived through the pandemic, and has reopened and is trying everything they can to continue to survive and thrive. They lost 2 members of staff to suicide because of the lockdown. So there are other damage that is being done through the severe lockdown that we have endured. Now, the vaccination program, you're right, the vaccination program is our way out of this. So at 87% almost of all adults vaccinated with 1 dose, 2/3 with 2 doses, I think it's the right time because obviously as we take advantage of the summer where schools being out will have a downward pressure on the R number. Of course, the socializing and interaction has an upward pressure, but there is no perfect timing for this. It's the right thing to do because actually, as the Secretary of State, and you mentioned that in his interview today in the Telegraph, talks about 13 million operations that we need to make sure happen.
Indeed.
And the NHS stands ready to do that. So there is no perfect timing. We just have to remain cautious.
I want to come to that in a second, but let's just deal with the next couple of months. Could you actually tilt the playing field a bit in your favour by doing certain things? For example, at one point we talked about test and release. That is to say, people like me old people who've had 2 vaccinations could be tested rather than having to self-isolate. Or that we could release NHS staff from the possibility of self-isolation. Now, are you thinking seriously about those kinds of steps that would at least take away some of the potential for chaos?
Yeah, so really good point. So the NHS app, one has been an incredible success, 25 million downloads of the NHS app, hundreds of thousands of people saved from being infected. But of course the app was developed and operationalized at a time when we didn't have vaccines. Now we're in a world where we have almost 87% of people protected with 1 dose, 2/3 with 2 doses by 19. So we should absolutely, and the team are looking at how we use that app in terms of alerting people to those around them who test positive. Of course, if you do test positive, you have to and should rightly then self-isolate. But it's important to look at that in a new context of this massive vaccination program and make sure that it is fit for purpose for this new world, including, for example, being able to take maybe 5 days, as we have piloted, of lateral flow tests and upload them to the system rather than having to self-isolate. In the case of NHS workers, if they're wearing their protective equipment and PPE, then even today they don't need to self-isolate if they feel that although they've been pinged, it's advisory, but if they feel they've protected themselves properly, then they don't need to self-isolate. Hence why we're able to plan for how we cope with what the Secretary of State talks about, which is getting back to a place where we can have those 13 million operations happen. Those with cancer, 19 out of 20 getting the treatment they need already, but we want to be at 20 out of 20.
So those tweaks are on the table. That's news for us. Can I just take you to the point that you were discussing a moment ago, which is the backlog? Health Secretary says possibly 13 million people. How will opening up on July 19th help in any way in dealing with that backlog of 13 million patients who the Health Secretary himself says have not come forward in the last year and a half? I mean, how does that make sense?
Well, because as he quite rightly outlined in his interview, that it's that sort of British sense of wanting to protect the NHS and fairness, and whilst we are in a severe lockdown, people may have not been coming forward. I think it's right now, with the £1 billion that is totally focused, that we have made available to the NHS on dealing with that backlog, that the NHS now is able to do that. It has done that for cancer patients throughout the pandemic, and I absolutely admire and hold in real awe my colleagues in the NHS and what they've been able to do. But this is the time now to effectively make sure that we support the NHS to deal with that, whilst also making sure we do the booster campaign in September and the flu inoculation in September, because actually what you want to make sure is in the autumn period, where we haven't had much flu virus circulating in communities, we protect against flu and COVID, because in a bad year, 20,000 people could perish because of the flu virus.
Let's get this absolutely clear. I mean, it sounds like what you're really saying here is that you think that the possibility of 100,000 infections a day is less alarming than, for example, the problem that you're looking forward to, or the prospect of problems in the autumn of a different kind, flu and so forth. Can you just get clear with us, what is it that has persuaded you to take effectively to take this risk that we might find ourselves with this huge number of infections, with all that implies for the raised possibility of mutations and new variants that the vaccines can't deal with?
So it's worth just reminding your viewers that our very strong, stringent border controls continue, and you have to take a test before travel, a test after 2 days of being here. The red list remains in place for over 50 countries. That's really important, because that's how, even if you are double vaccinated and you want to come in from an amber list country, you still have to take that test after 2 days of arrival. So we're not, throwing caution to the wind in this case. The guidelines you will see next week will also demonstrate very clearly what people need to do and are expected to do. For example, on mask wearing, all these things are a cautious but pragmatic way of getting us back to as close to normal as possible by the 19th of July. Now, the important thing to remember is that this is not over yet, and we have to be careful. We have to be vigilant. We have to see what's happening in other countries vis-a-vis variants. You're absolutely right, and that will continue. That will not change. So this is not a let's just go out and forget about the virus. The virus is still with us, and we have to be cautious. But it's the right thing to do, because as I hope described to you what was a moving experience for me on Friday, of a businesswoman telling me that 2 of her staff committed suicide because of lockdown.
All right. Minister, so much more that we could be talking about, but unfortunately today is today, and I had to take just a few seconds to ask you a question that we're asking all our guests today. What's the score tonight going to be?
I am not even going to attempt to answer that question, Joe, because I do not want to jinx it. I travelled with England to Germany. I travelled to Japan.
No. You can't see, but I have a whiteboard here. There are thousands and millions of people who are hanging on your every word, and we cannot leave this interview without a number, 2 numbers on this whiteboard. Come on.
I'm not going to do it. I am not going to do it. I can't. It's too painful. 55 years ago, we had a win. We will win tonight. I am 54 years old, and I literally, as I say, I'm a football fan. I've travelled with England to Germany and to Japan. I am not going to jinx it today, this morning, to your viewers, but we're going to win.
All right, I have written the word chicken on my whiteboard here. Let me see if you've got an answer to this question. Bank holiday or not, if we win?
I'm not going to jinx that either. There is no way I'm going to be presumptuous on your programme and say that we're going to have a bank holiday.
Okay, double chicken Nando's here. Thank you very much, Minister.